Hi there, I'm Marissa. I'm a volunteer and intern with Step Up for Mental Health, which is a nonprofit-based organization in Chicago, Illinois. And a big part of our mission is to help individuals and families who are dealing with mental illness and a lot of unfortunate situations such as poverty, homelessness, disability, and so much more that has a great effect on a person's mental health. And we try to help find them the resources that they need. Another big part of our organization and our mission is to help destigmatize mental health. And one way to do that is through talking about it, and another part is through education. So that's why I'm here. And that's what this series is all about. So on this series, we're going to be looking at new developments within the fields of psychology surrounding mental health in order to start a discussion and start feeling more comfortable around mental health. A lot of times talking about mental health has a lot of heavy subjects that people don't want to talk about. It makes them feel very, very uncomfortable. That's why on this series, I'm also going to be inviting you to get in your comfiest pajamas, like me, grab a nice cup of tea, and get yourself in a safe surrounding area. And let's start getting comfortable talking about mental health. A lot of studies that are being done right now are looking at the effects of COVID-19 and mental health. And in a recent study in the UK with 506 participants, found that COVID-19 had a significant effect on body satisfaction. And so in the experiment, all 506 participants, equally distributed between men and women, were given 5 surveys. And in those 5 surveys, they were looking at stress between COVID-19, stress between everyday life, and body satisfaction. For women, they were given surveys surrounding body satisfaction as a whole and the desire for thinness. And for men, they were given surveys surrounding body satisfaction, as well as the desire for muscularness and low body fat. And to no surprise, the researchers found significant correlations between COVID-19 stress and body satisfaction. So to break it down a little bit farther, it was found that in women, the desire for thinness came from both COVID-19 stress and generalized stress. So there was a correlation between all 3 variables. However, body dissatisfaction had a significant correlation between COVID-19 stress, but not generalized everyday stress. And in men, there was a correlation between COVID-19 stress and the desire for a lean body, low body fat. However, in the desire for muscularness, there was a correlation between both COVID-19 and generalized stress. So what does this all mean? Well, the researchers discuss in their paper that possible correlations are coming from prolonged exposure to social media and our screen time, which we already know has a negative effect on a person's body image and satisfaction. There's also less access to gyms and workout facilities, which for a lot of people has a negative effect on their body image and satisfaction. As well as a lot of changes and disruptions in our daily schedules due to COVID-19, whether it's sleep, food, work, etc. And a lot of those things can have a negative effect on the way that we are perceiving ourselves. And so why is all of this important? Well, unfortunately, eating disorders are generally the more taboo of the mental illnesses and generally are not talked about, which is really unfortunate because eating disorders actually have the highest mortality out of any mental illness. And that's a really heavy statistic and kind of scary. But that's why it needs to be talked about. And that's why we need to get more comfortable talking about eating disorders and understanding why people are feeling less satisfied with the way that they look and trying to lift each other up. So that's why we need to be talking about eating disorders and talking about mental health in general. And part of that is, like I said in the beginning, through education and through discussion. So let's start getting comfortable talking about mental health. I hope you enjoyed this video, and if you want to learn more about the experiment, I'm going to be posting a link in the description. I'm also going to be linking all of our social media accounts for Step Up for Mental Health if you want to learn more about our organization. I hope this video was informational for you, and I hope that it starts to bring up more discussion surrounding mental health. And as always, let's start getting comfortable talking about mental health.